If we think about family engagement, we like to think about it on a continuum and recognizing that this is a bit of a change in process from how systems specific to child and youth mental health have historically worked with families or even viewed families. So how do we think about bringing families up to a place of partnership with a multi-level in a multi-level way? So not just at service delivery. So beyond that therapeutic alliance, how do we engage families and how do we determine how we're engaging families? So we took Hart's ladder of participation and modified it and borrowed from it to demonstrate some family engagement thinking. I believe that the more fluent people become in Hart's ladder, the more fluent they're going to become in the practice of family engagement, because everything that you touch in your work, regardless of whether you're working directly with clients or if you're even in just a corporate role, you can determine what level of engagement, whether you're even engaging. Because there are some situations where you realize, wait a minute, we haven't even got onto the ladder of engagement. And as we go through this, we're going to think through how you don't always have to go from I'm not even on the ladder to I'm co-developing, but how do we always think about how do we bring it up a rung? So the bottom rung of the engagement ladder is manipulation, decoration, and tokenism, which we want you to avoid. But that's not to say that those are not steps, but you have to be able to identify when you are unintentionally, and I think that's a really important point to make, is that in my experience, never have any of these things been done intentionally. This is sometimes things that are done where people really do feel, okay, we're going to engage families, but because they haven't been thinking through that entire ladder, that sometimes they fall onto these rungs. So it's important also to forgive yourself. If you pick something up and you realize, okay, I think this might be manipulation, it isn't about, okay, I'm doing this wrong. It's about how do I even just bring it up to the next rung? So how do I correct that families may be feeling manipulated in this process? So to help you understand, I'll give a couple of examples of each of these. So manipulation might be something like you have a ministry survey that they want completed by families. And an agency has learned through consultations with families that they hate doing ministry surveys, that sometimes they don't understand what questions are being asked. It takes a lot of time. So as an agency, you take that information and you know that families are going to struggle with it, but it's really important that families have their voice to it. So you prepare answers to all of the survey questions, send it out to all of the families and say, this is a survey that needs to be filled out by families. Ministry wants some family voice. We know that you don't have a lot of time, blah, blah, blah. So here's the answers. You can just copy and paste, put in and submit your survey. That is a manipulation of family voice. Another example of manipulating family voice might be you ask families very specific questions in a consultation and you realize that the information is maybe not as flattering as you were hoping for, so you start to change the tone of a final summary report. That too is manipulating family voice. Decoration would be something like, and this happens, I would say the most common that it happens, because agencies really want to acknowledge the families, but they do things like they'll have a big gala and they invite some families to sit at a table and they acknowledge these are some of the families we serve and maybe they're all given flowers or something. That's decoration in the sense that if the families were only invited to sit at that table and to receive the flowers, that's using them as sort of props and not having involved them in if that is actually how they want to be acknowledged. Are they comfortable being acknowledged that way? What was the event? Like, did they have any say in who the speaker was? Who's the target audience? Things like that. Another common thing around decoration is we're opening a new building. So let's get a family and a youth, and they're going to help us cut the ribbon. And we're going to have the press there, and we're going to take pictures. Well, if they haven't been involved in any of the decision-making process and where that new building is going to be and any of that process, and they're only there to, have a photo op, that's decoration. Not saying that it isn't good and it helps empower and build relationships, but think about how you can more meaningfully involve them in that. Tokenism is another one that's very easy to fall into, especially now where there is a bigger appetite to have families start to participate at a governance level in different planning advisories, things like that. Unless there's a mechanism to ensure that voice is actually having some impact and influence, then it could very much be tokenism. So in a board, you put one of your family members on a governance board of an agency, for example, but that family member either maybe doesn't have the capacity or experience to even know how to participate in a board. They never say anything, that they're just literally there as a body in the seat. That's very much tokenism. So if you're involving families, I think you always have to be asking yourself and checking, have they had impact and influence? And if they haven't, then potentially you need to do a bit of an audit to ensure that you aren't moving so fast that it's tokenizing for families. So the next level on the continuum is informed and consulted. So that, when I think about that, I think it's very unidirectional conversation. So a survey might be that families are informing you, right? You have a newsletter, and that goes out to families. That's informing them. So it isn't sort of a collaborative exchange of ideas. Consulted is, and sometimes it's only appropriate to inform or consult, right? So consulted might be that you have a framework of something that's established and you want to consult with families, but there isn't a lot of wiggle room. Like there's not a lot that they're going to be able to impact or influence. There might be some. So that's consulting. And the trick with those is where it's really appropriate is just to make sure that that's really clear. So if you need to consult within a set framework for families, then you need to make sure that they understand where there's ability to have influence and impact and where things are just the way they are. Like stats are stats. So you can consult with them around maybe where or how you represent those stats, but you can't sort of start to manipulate that data. So that would maybe be a consultation. You have some form of report, annual report, for example. There's a lot of things that, they're going to be consulted on. Like you could, for example, show them the board chair's message. They can reflect on, I'm not sure that represents families or how that makes you feel, but it's still really up to the board chair if they want to change that. So you're consulting with them, you're having their input, but again, it's fairly unidirectional. And then the very top layer is where we want the system to get to, and that's co-development and partnership. So that's basically families have an equal seat at the table as everybody else, that families are seen as partners, as allies, that when you're developing, like right now, the community mental health plan, they were consulted. Most families and service areas consulted families to have input into the community mental health plan. There were some areas that actually had families involved from the process, right from the beginning to the end. So all of the core service providers plus families were sitting at a table. That's the difference between consulted and co-developed. So they have direct impact, influence. They're signing off on it. They had the same considerations that all of the other community partners had. So that's sort of how you think through it. And I actually did this to just corporate staff. So they have no direct connections with families, and they were saying, well, we don't really need to know family engagement. But so we took some of the work that they do and walked it through the ladder and showed how even that can have influence and impact on a service delivery system. So for example, human resources, they're hiring a child and youth worker. So that's not even generally on Hart's ladder or on the continuum of engagement. Like when we went through it, they said we have not, like, we do up our job posting, we post it. So when you think about how do you bring that up? So have we ever talked to families about what they look for? What type of child and youth worker? What are the skill sets and things like that? So how do you build that into a job posting? Some of the traits that you're looking for. If you want to bring it up even higher, is there a partnership in your hiring mechanism? Do you have families or youth co-interview any of the staff? And how does that then start to affect how services are delivered? So when you think about it, if you come in for an interview and you're being interviewed by family, agency, and your youth, for example, you're giving the message before they even start employing that who you're working for is actually all of us together, and it isn't the other way around. So it pretty much sets the tone before they've even started on how families are seen as a very close ally in all of the levels of the agency, which of course is going to influence how they deliver service.